At the moment, the three psychologists are myself, Ruth Yoder, and my colleagues Cara O'Grada and Claude Waters. We understand that each person had a different path that led to obesity, and that managing weight is quite complex. When we first meet, we will hear your individual story. We'll ask about your present living and work situation. We'll ask about your personal history, including childhood experiences, your weight history, and your feelings and beliefs around food and eating habits. We'll also ask you to fill out some questionnaires. We can help if there's any difficulty doing this. At least a quarter of all of our patients come with a history of depression. We understand that this makes lifestyle changes more difficult, and we will support you. While it is painful to recall bad things that happened in childhood, these can be exactly what needs to be talked about when they continue to affect your life today. For many of you, we will strongly suggest that you get psychological therapy locally. At the end of this presentation, we will give you the names of some of these organisations that can provide weekly therapy. Over the last 20 years, we have collected a lot of common experiences that patients describe that make weight management difficult. Here are some of these, and we will talk about all of them to each of you. Some will describe your experiences, and some will not apply to you. We take each individual situation into account. While each person is unique, it can be helpful to describe some of the different groups we've noticed over the years. About 1 in 5 patients have binge eating disorder. I will describe this in more detail in the next slide. About 1 in 5 of you is very reliant on food to manage your emotions. Again, about 1 in 5 gained weight because of years of yo-yo dieting, when you would lose weight only to regain more and then try another diet, and the same thing would happen. Years on, and the weight is a lot higher than it was before the first diet. About another 20% of our patients gained weight due to a medical condition or because of particular medications. Some examples would be severe asthma, an untreated sleep disorder, or long-term steroid use or antipsychotic medications. And some of our patients report more than one of these categories. For example, they may be on medications that promote weight gain and have an eating disorder and have a history of yo-yo dieting. We screen everyone for binge eating disorder. This is not eating a takeaway or some cake when you're trying to diet. It is eating what most people would agree is an unusually large amount of food eaten within 2 hours with a sense of loss of control, that is, you just can't stop. Sometimes you binge eat when you're not hungry. The food is usually eaten in secret and quite fast, and the person feels very guilty and upset with themselves afterwards. When this happens at least weekly and causes a lot of distress to the person, we call it a disorder.
Emotional eating is the use of food to manage feelings. Many people might describe comfort eating as a habit of snacking, often in the evenings or while watching TV. This kind of eating doesn't usually change much if you're in a good mood or not, and so is not strictly speaking emotional eating. It might be a way to relax and is a form of pleasure rather than to push down difficult feelings. We all develop ways of coping during our lives to help us manage difficult feelings and life events. And these strategies develop because they work for us in the moment, so we keep doing them and they become automatic. But sometimes coping strategies we develop lead to unintended consequences down the line. And emotional eating is an example of this, where eating might become a way of trying to stop or push down uncomfortable feelings like sadness, anger, or fear in the short term, but can lead to more difficulties down the road, including mood issues and health issues. Feeling stressed is a common experience and uses up a lot of our emotional energy. This can get in the way of our ability to look after ourselves and leave us feeling overwhelmed and out of control. It can also leave us feeling too tired or busy for activities that help us to recharge and feel good about ourselves, and activities that are focused on our well-being. If you think this is an issue for you, we can work with you on building up some strategies to manage stress more easily. It can be a challenge to put our own needs first when we are busy or used to looking after others. And if you think that might be a barrier for you, we will support you in making sure your own needs are cared for, as well as the needs of others in your life. It's very easy for us all to fall into unhelpful patterns as we try to manage thoughts, feelings, and the demands of life, as we saw earlier with emotional eating. Our thoughts, feelings, actions, and environment all interact with each other to create patterns in how we respond to things and in how we keep those patterns going. This example shows how a stress cycle might work. Stress can lead to feeling overwhelmed, which lowers our energy and can make it hard for us to be able to think through our problems. This can then lead us to feel a lack of control, which makes it hard to put self-care first. To cope with this, we might turn to old quick fix coping strategies for short-term relief. Then we can end up blaming ourselves for the actions we took, which adds more emotional stress, and the cycle begins again. If you find yourself struggling with unhelpful patterns, we can work with you to help change these. And this is just one example of many different patterns that can develop. Changing patterns that have developed often involves a number of changes which each influence each other. Living with obesity and working towards sustaining best weight involves a number of factors that also affect each other. From a psychological point of view, these can include difficult childhood experiences that can continue to affect our mood, our relationships with ourselves and other people, and our mental health. Also, all or nothing ways of thinking will have a knock-on effect on our mood, on how we feel about ourselves and whatever we're struggling with, and in what we do in response to that. An example of all or nothing thinking might be when feelings of self-worth come to depend on whether we are losing or gaining weight, and it becomes difficult to see beyond that. Another very important factor is how you treat yourself when you're struggling, and whether that is with self-blame and criticism or compassion and acceptance. It's very easy to fall into the trap of self-blame and self-criticism when things aren't going as we'd hoped or planned. This is especially true when living with the complexity of obesity. Self-blame can easily develop over time and can lead us back into all or nothing ways of thinking, beating ourselves up, and affect how we see ourselves and our struggles. Developing a capacity to be more compassionate and accepting of ourselves and what we're up against when we struggle can have a very positive effect on how we look after ourselves in all aspects of our lives, including living with obesity. This is far more likely to motivate us to focus on our well-being than when we feel shame, which usually makes us want to hide, give out to ourselves or someone else, or give up. If you think this might be a barrier for you, we can work with you on finding a way out of the blame-shame trap. We can do this by increasing understanding of the complexity of living with obesity and how weight seems to have a mind of its own and doesn't respond in the ways you expect despite your best efforts. Focusing on working towards the best weight for you, which includes the overall quality of your life and how you feel about yourself, and is motivated by your care for your well-being. Reconnecting with the enjoyment of life experiences like meals, activities, and interests right now, rather than waiting until you have lost weight. And learning to be kind and supportive to yourself, especially when you're struggling and things aren't going according to plan. Sometimes people might need more psychological support, and we signpost to the following areas among others. The National Counselling Service is a free HSE counselling service for adults who've experienced any kind of abuse or neglect in childhood, and there are local services nationwide. Overeaters Anonymous also have local groups nationwide and operate using the same 12-step program as Alcoholics Anonymous. This can be particularly useful for people who identify feeling addicted to foods or top-shelf foods. Local adult mental health services operate around the country for people who are struggling with moderate to severe mental health issues or suicidal thoughts or feelings. Primary care mental health services are also operating around the country and help people struggling with mild to moderate mental health difficulties. Both these services can be accessed through referral from your GP, and we can help to facilitate that for you if you wish. The Samaritans provide a listening ear for anyone who needs it 24 hours a day, 7 days a week, and can be contacted on 116 123. And also PITT House, who work with people struggling with self-harm or suicidal thoughts or feelings. Thank you for listening, and we look forward to meeting with you soon.